When I measure penises, I push really hard down onto the pubic bone to the point where it actually hurts, and I stretch the penis as much as I can. And that's the best way to get a good measurement of the penis, right? You basically are trying to pull the penis off the body. And coincidentally, the flaccid penis on maximum stretch, that is the same as erect length. Those are identical. So that's how we can have good science, take good measurements, because we know those numbers are similar. So if you're getting a penile implant, for example, if you, before the surgery, take your penis, you pull on it as hard as you can, don't pull your penis off, but don't hurt yourself, that's going to be your erect length with the implant. That's what to expect. And a good implant surgeon will actually do that. But yeah, I think it's very reasonable to take some pictures. The other thing that patients can do is they can actually use a vacuum erection device. And when they first start using the vacuum erection device, they'll kind of inflate the device as much as possible, and their penis will come out to point X. Mark it with a marker. It's not like you're going to sell your VED on eBay, right? So you just mark it with a marker on the cylinder, and then 2 weeks later, see if you're making some progress. And most men, lo and behold, you'll start making some progress, especially if you had shortening. So you can win some of that length loss back if you use a vacuum erection device. And again, if you have experienced loss of length and you're considering getting a penile implant, it probably pays to use a vacuum erection device for at least 6 weeks, or another form of penis stretching to try to make that tissue stretchier like it used to be. Grab the head of the penis, kind of pinch it in the fingers, and pull it straight out from your body. So if you're lying down, like straight towards the ceiling. And that's how you're going to, if you want to take a scientific measurement, that's how you do it. And then you take a ruler and you'd rest the base of the ruler at the pubic bone, the bone right underneath your belly button. And so that length from the bone to the distal penis is typically how we try to measure and keep it accurate. It doesn't matter if you're circumcised or non-circumcised. Stretch penile length is going to be similar, but remember, you want to pull on the glans penis. You don't want to pull on the foreskin and measure the end of the foreskin, because that's cheating, right? It has to be the tip of the glans, because otherwise the people with foreskin will be naturally have a few extra inches there. A vacuum erection device that costs less than $100, it probably won't be medical grade. It probably won't do what it's supposed to. But anyway, there are various companies that have legitimate medical grade approved vacuum erection devices. We're trying to, push the envelope. We're trying to do a good job of exercising the penis. So I presume you're asking for trying to have intercourse, right? And then the other important thing with the vacuum device, right? It's not just the vacuum device, it's the constriction band at the base of the penis that's going to try to trap the blood there. I really like to describe the penis like a bike tire. And the analogy is as follows. A normal bike tire, you can pump air when it's flat, you can pump air into it. The air is contained. You can drive on the bike tire. Terrific. It works great. Penis, blood flows in there. It's supposed to be trapped. You can use it for whatever you want. It stays hard. Terrific. Now, when you have venous leak, this is akin to having holes in the bike tire. And so you can put as much blood into the penis as you wish. It's going to start to flow out at an equal rate through those holes. Analogy bike tire, you got all these holes in it, hook up an air compressor, it'll look hard for a second, and then as soon as you start to drive on it, it'll go flat. And so that's the explanation why so many men will ask, why is it that I get these erections? They seem pretty good. The moment I try to use them, they disappear and they're not usable for intercourse. Yeah, that's exactly what's happening. Basically, you have this venous leak, and as soon as you try to put any kind of stress on the system, the blood kind of tracks out. So venous leak is one main reason why men don't get erections. The other reason is problems with blood flow into the penis. That's arterial insufficiency. And so that's where, like, literally the person pumping up the bike tire, the pump is broken or the air compressor is broken, you're not getting blood flow in. So we're really good at getting blood flow in with pills, with vacuum device, with injections, but it's trapping the blood. That's the trick. And so the vacuum erection device, that ring at the base of the penis, that helps seal the blood in, kind of like trying to patch those holes. And that's why those are effective sometimes, in addition to some of these other medications. But true venous leak, you can give guy penile injections, a horse dose, like as high as it goes, and the blood vessels will open up terrifically. Blood can flow into the penis, but that's flowing out at the same rate. Won't work. That's venous leak, and typically surgery is what you need for that. But when we're talking about using a vacuum erection device for kind of penile rehab, The typical regimen that we'd recommend is applying the vacuum device, inflating it 15 to 30 minutes, somewhere in there, inflating it just to the point where it begins to hurt, kind of like stretching, right? You don't want to tear your hamstring when you're touching your toes, but you want to go to the point where you just start to feel it stretch and let it sit there for 15 minutes. That's penile rehab. You're pulling blood into the penis, you're stretching the tissue for a fixed amount of time. So I think you should do that regardless. Now, whatever you want to do in addition to that, have at it. I mean, I don't, whatever feels good, whatever you'd like to do. You've already done your penile rehab with the vacuum erection device. I don't think you need to worry about, specific techniques, with the one caveat: if you're going to try to have intercourse, or if you're going to try to put your penis in something, make sure the erection is reasonably strong, because the time you injure your penis is when it's kind of a softie and you get this kind of torque force. That is what leads to Peyronie's disease, this kind of abnormal scarring of the trauma to the penis, typically from, some kind of axial loading, some kind of sex. And that's where you'll get curve. So if you have a curvature, whenever you're going to try to have sex, make sure your erections are as good as possible. When we talk about penile trauma, it's always with a strong erection, but it's when you get this, somebody zigs, somebody zags, you pull out and you hit a bone or something. And so it's with a strong erection that you get this torquing force, and you get a small tear in the penis. Sometimes that will heal inappropriately and cause Peyronie's disease. Other times it will not. The problem is when you're trying to use an erection that is barely good enough, 6 out of 10, that is also very susceptible to this torquing injury, because now it doesn't have this actual rigidity that prevents it from getting injured. So I agree, it is a little bit counterintuitive, but the bottom line is, when you are having intercourse where you're putting stress on the penis, you want to have as strong as an erection as possible. And if you've had a previous trauma and a previous Peyronie's disease and proven yourself able to scar abnormally, you need to be even more careful, because I've seen some penises that have 3 areas of Peyronie's curvature. I want to back up a bit and say that sexual counseling, sexual therapy, the tools that somebody in your specialty can provide to patients are invaluable. They are just as important as the mechanical things that a surgeon can do. Some of the other tricks that you can give patients, confidence, realistic expectations, alternative strategies to make things happen, are just as important as surgical solutions. First of all, sexual therapists, most people don't even know what they do, number one. Number two, they provide a very elegant toolbox. And when we talk about many problems in sexual dysfunction, it's the sexual therapist solutions often are more durable and useful than the pills or the vacuum device, because it's never just mechanical. It's always a combination of both brain function and physiologic blood flow penis function. I'm trying to put a big plug in for sexual therapy in collaboration with surgical and traditional medical approaches, because ultimately the combined approach is always best. And we have a lot to learn from one another. Penile implants or penile prosthetics or IPPs, inflatable penile pumps, these kind of things. It's a very elegant solution that kind of mimics Mother Nature. So getting back to the tire analogy, instead of blood flowing in the penis and being trapped there, now the patient gains control and is able to control manually with a pump that's hidden in the scrotum, normal saline flowing into the system and filling the chambers of the penis like blood used to. But now you're filling this new liner we've put in, which will trap the saline effectively. And then you've got a usable penis, because you've got a hydraulic system that is very strong and it produces a high quality erection, which has a very high satisfaction rate. So ultimately, when we do studies, when we ask patients, would you do this again? And we ask their partners, would you encourage your partner to do it again? Depending on which textbook you read, you're somewhere in the 85 to 95% of patients are satisfied with the surgery, which is very, very high, mind you. It's very difficult to get those kind of numbers with any kind of medical procedure. So the bottom line is, it's a very good procedure, and it provides a lot of satisfaction, and it's restorative. It lets you have on-demand intercourse again, if that's an important goal for you. And it shouldn't necessarily affect the sensation of the penis per se, because the nerves that control sensation, we don't go near them during the penile implant surgery typically. The nerves that control erections, the one that were damaged from the prostatectomy, those are in a different area. And those already have been taken a hit, and that's why often we need to do the surgery. So we can do the procedure, which, depending on which surgeon you have, on average takes around an hour. About half the surgeons in the United States send patients home the same day. The other half keep you overnight in the hospital for 24 hours. It's typically 3 to 6 weeks before you come back and see your surgeon again and using the device on average. There's obviously people who are faster and slower. It hurts the week after surgery for sure. Anybody who tells you differently, run for the hills. It's a sensitive area. That's why we're trying to fix it. But you get through that time, and then, most men, after 1 or 2 months after the procedure, are using it for intercourse.